Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you've tuned in to another episode of my virtual global clinic. So, for those of you who are new to the channel, welcome. I'm Dr. Khaled Sadek. I specialize in the removal of cysts and lipomas, and every Wednesday, Friday, and Sunday, we run a virtual global clinic where we take questions from all across the globe on various topics, not just relating to cysts and lipomas. If you don't know already, we have our website, lipomacyst.com. So if you see anything that you think may apply to you, then please reach out to us at lipomacyst.com. You can also find lots of useful information on my namesake website, khaledsadek.com. You can also find us on Facebook, Instagram, and Twitter. So for you who have watched over the past, I don't know how many months, we've covered a lot of topics. We've covered topics ranging from thyroid disease to rheumatoid arthritis to skin conditions. And today I said we're going to touch base on mental health and the impact of coronavirus has on mental health and what we can do to make us a little bit stronger, a bit more resilient to get us through these long lockdowns, especially when that spectre of a second wave is hovering. For those in the United Kingdom, you've all heard the news. The Prime Minister Boris Johnson is saying officially that the second wave is soon upon us and that we must make concessions in our social gatherings in order to avoid a big second wave. So there's plenty going on in England at the moment, and there's plenty more going on across the globe. And the race is on to find that vaccine, to find that immunity, that long-term immunity. So hopefully that is in the pipeline. So when we talk about mental health, in a short while, we'll be discussing what we can do, how we can stabilize it, the different paths we can go, where to turn to, how to be signposted and whatnot. For those of you who are regular channels, you'll recognize I'm not in my usual filming environment because I am not in there at the moment. So don't be put off if you haven't seen the boat or the big plaque at the back. We do have a globe back here. I'll try and show that to you in a little while. Also, what we're going to be discussing today is the video. So we released a video because it's got some really interesting content. It's actually got lots of hair, which is quite unusual. So that's coming up straight after this live chat for the premiere. And in the last video we had, it's quite a juicy little back cyst. We've had a couple of those lately, and like I promised, October is going to be dedicated to lipomas. So Lipoma October is a big Oktoberfest of lipomas. So mental health and how to stay well at home. Taking care of your mind as well as your body is really important if you're going to be staying at home for long periods of time regarding COVID-19. A lot of people complain that they feel worried or anxious about their finances, about their health, about those who are close to them. And perhaps you're feeling bored, you're frustrated or lonely. Whatever it is, it's important to feel that it's okay to feel this way. This is the normal reaction that you may have in a global pandemic. So that's completely normal. So rest assured. And remember, for the large majority of us, those feelings are transient. They're going to pass. They won't be around forever. So while we're having an acute episode of loneliness or anxiety, it will pass. So just remember that as well. Staying at home may be difficult, but remember, you're helping others and yourself, protecting them and the community from the spread of the virus. There are things you can do now to help you keep on top of your mental health and well-being and cope with how you're feeling while staying at home. And so I thought I'd go through my top 6 tips for staying on top of it. And I think they're quite useful. You don't have to obviously take them all on board, but they are some simple guidelines. And of course, do contact your regular physician for medical advice. So number 1, I'd say, is plan your day. Plan your day. We're all adjusting to a new normal. I don't like the phrase, but it's a new normal, rather strange way of life. And this has a risk on our mental well-being. So being able to attempt to put some planning to the day so that we're not kind of in our pajamas throughout the day, making sure we have regular activities, making sure that we find activities that are essential for our identity, our self-confidence and purpose, So just think about how you can plan your day. Start your day roughly the same time every day. Go to sleep the same time, wake up, and make sure that you kind of have a down, right? That's number one. So plan your day. Number two, move, everybody. You got to move. You got to move. You got to move. You got to stay active, because if you are active, it does a number of things. Number one, it reduces stress. I mean, you can't say no to reduce stress. So number one, it reduces stress. Number two, it increases your energy levels and it makes you more alert and it helps us to sleep better. You know how I am really, really fond of sleep. So, if you're doing your exercise, you reduce your stress, you increase your energy levels, and you get a good night's sleep. You're in. I mean, there's no point going through the rest of the other topics, because that is just a massive one in itself. But how do we do it? Well, you've got to explore different ways of adding physical activity and movement into your activities in your day, and know what works best for you. Even if you're at home, there'll be loads of exercises to do to keep your body moving. Get yourself, a little bicycle or a skipping rope or a yoga mat. There are plenty of online videos and tutorials and exercises that you can take part in. So do make the most of YouTube, free resource. So that's my number two tip. So number one is planning. Number two, moving. Got to move it. Number three is really kind of try a relaxation technique. Relaxing and focusing on the present can help improve your mental health and well-being and dispel or lighten negative feelings. For those of you who are familiar with mindfulness or have ever practiced mindfulness, you can always Google or on YouTube just search mindfulness techniques. And that really is about kind of focusing on the present, thinking about what is around me, as opposed to being all consumed by worrying and negative thoughts. Because what you try and do is, a lot of us do it, if we're stressed out, we'll focus on that negative thought and we'll keep thinking over and over again. And before we know it, we're down deep into the rabbit hole and there's no saving us. So think about mindfulness, where you can accept those intrusive thoughts coming in, but just say, listen, just park those for a moment. I appreciate they're going to keep coming in, but I want to focus on the present. So just, I'm sitting in this chair, so I want to feel my feet on the ground. I want to feel my back on the spine of the chair. So think about the present more than what is going on in your head. So that's mindfulness in a nutshell. Right now, right here, right now. That's mindfulness. So there we go. So try meditation, try breathing exercises. And when you do that, you got to think about, what does it feel like to breathe? You can feel the air going up the nostril. You can feel the sensation of your lungs filling up. Your chest is broadening. You can feel the breathing exercise. So think about what it is like to breathe, as opposed to thinking about what's making you depressed or anxious. So that's my number three. Try relaxation techniques. Number four, connecting with others. Staying at home, especially if you live on your own, can feel extremely lonely. So find creative ways to keep you in touch with your co-workers and your friends, and you're helping yourself and others. You're going to feel more connected and more supported. And so you've got to explore ways of connecting with those who you work with. Okay, so there's a lot of talk about online conferencing, so Zoom, Google Workplace, Microsoft all have a platform. So why don't you have a Thursday night in, send your friends an invite, and you can all have a massive Zoom session. You can do it on Skype, you can do it on WhatsApp. Think of the creative ways where you can connect with your friends. So a lot of people in big cities, singletons, living in studio apartments or one-bedroom apartments, maybe your housemates are out of town. So think about how you're going to connect with people in a total lockdown. So exploring ways such as, social media, the phone, the video chats, anything really to kind of get that support going. Even sending a supportive text saying, hi mum, how are you doing? Hope you're okay. So stay connected is number four. Number five, take time to reflect and practice self-compassion. So a lot of us will work, 9-to-5 jobs, we'll come back, and we don't really appreciate what we have in our life. So a very good way of appreciating what you have in your life is just jotting it down. Every night before you go to sleep, put down 3 things that you really feel grateful for. One, I feel really grateful that I've got a job, massive financial issues. Number two, I feel really grateful that my local coffee shop is open. Number three, really grateful for the loved ones around me. So put that down, put that self-compassion practice in thoughts such as depression. So think about how you're going to take time to relax and reflect, whether you're going to meditate or you're going to pray, whatever it is that works for you, to have the time to reflect and practice that self-compassion so that you can give yourself all the love you need. Okay, that's tip number 5. Tip number 6, improve your sleep. I don't think I need to repeat myself, but I'm sure you've all heard me talk about how you can improve your sleep. And if you haven't seen that, I think the last video we spoke about sleep, so check out the last VC, and I've done lots of other talks about improving sleep. But sleep is really the center cogwheel for mental health. So if your sleep is out, everything else falls apart. So make sure you're sleeping well, cut out your caffeine, cut out your alcohol, exercise more, take showers, and that will really, really hit sleep on its head. So those are my 6 tips on how to stay mentally fit in a global lockdown. So I hope those were useful for you. Let me know your thoughts. Let me know if you've got any extra tips, anything I've missed, anything you've heard me say and you've tried it and you found it very useful. Let me know. Let's have a look. Let's see who's in the house. Zopiclone, thumbs up. That's cheating, Caroline Tom. Okay, let's scroll right up to the very top. So we're going to say hello to lots of people today. We've got Bridget, welcome. She's number 1. Prince of Zam, Dr. Sarah, orthodontist. A Pastrana, welcome. Sherry S. Gail Sharp, Dawn Wood, Anne Brooks. Janie Swainigam, welcome. Andrea Hauschman, Lynn Crawford, Oklahoma, Burkburn from San Diego, Susan Burt, Chris Badger, Louise Kemp, Cheryl Puga, wonderful people turning up today. Donna Adam Kennedy's from Oklahoma City, Kim Matthews, I've been in the house for 7 months, Margaret Brace from Lake Erie, Joyce Bauer, how are you doing? Oregon is in town, Oregon, Janie from Oregon, hope you're staying safe. Gail Marie Reynolds from New Jersey, welcome. Caroline Tom, I'm not moved, but by the next or previous lockdowns, I've had 3 years so far. Okay, well, look, stay strong. Ha ha ha. I think you're right. Teddy Zaring from Texas. Rusty Allen, welcome. Kim Matthews, I'm afraid to not go out because of high risk. I'm elderly. Mary Wolf, Sally's High from the Netherlands. So many wonderful people. Marion from Wales, she's missed us on Friday. Well, we're here today and we're big and we're better. I know that in the UK that it's not normal to practice circumcision on men, whereas in the United States it's common practice. Wondering why the difference. That's Sherry. Thanks, Sherry. We'll cover that in a moment. Connie Fontaine from California. How you doing? From Edmond, Washington. Denise, how are you doing? Baby Nurse, number 9. Hi, everyone. Mary Wolf. Some areas in the Netherlands have been locked down now. I think that's going to happen. I think lockdown is going to happen. Sandra Finn, welcome. From Anne, Riverside, California, is Anne Brooks. Christiana Maria Druta says, pimple popping is coping mechanism for me. I think you're absolutely right. Donna Adam Kennedy's Dr. Sarah, thanks for your brushing chat yesterday. Wow, that's awesome. Never had her braces so clean. Anytime this will pass. Absolutely, Joanne Kitwos. How are you doing? Let's have a look. I take meds for depression and anxiety, though sometimes it's difficult. Reach out to anyone. That's Denise. She's giving her advice. I've been spending too much time on crafting supplies. That's Burke Buns. Absolutely, do something you enjoy. I do mandala art, and you can find how on Pinterest. That's Janie Swainigam. So check out her stuff on Pinterest. Next is Marion. She's saying, wishing everybody a very, very safe lockdown. Dr. Sadek, I can't find your clinic and pop videos for Friday. Am I just missing it? I'm afraid we got held up at work, so we couldn't do the video on Friday. I do apologize. Lula Lena, welcome. How are you doing? She's missed the chat. A lot of people saying they missed the chat on Friday. Do apologize for that. Let's have a look. Jamie from London, how you doing? Belinda Cologne saying, following this channel and being proactive within the group has definitely helped me get through all pandemic anxiety. A lot of love from Belinda in Germany. Christy, love your videos. I hope everyone is well. That's Christy from Washington. Awesome, awesome. Belly breathing from Marion in Wales. Mindfulness is good, says Caroline Tom. Breathing exercises and singing swear words in a quiet place. That's her secret for getting through the... I'm hooked on the Escape to the Country on the BBC. That's Kim's secret. Singing swear words, says Rusty. Seems to be a very popular thing to do. This seems to be a very popular thing to do. I take mindfulness classes and it's so helpful to calm me down, says Janine. When you want to scream at someone, instead, you find breathing, meditation, focusing, and it just makes it all disappear. Thank you so much for that. It sounds like everyone is finding their own ways to meditate, to get that mindfulness. I'm thankful for Dr. Sadek, especially during this lockdown. A connection to reality and the rest of the world. Donna Kennedy's, a lot of love coming out to you, Donna. Kelly from Connecticut, welcome. Margaret Brace, Zoom Theatre. Awesome. Zoom Theatre sounds pretty cool. Bridget, so many wonderful options. Really like the ideas. Hopefully they'll be helpful. I struggle with my sleep, says Deborah. Premenopause and underactive thyroid. So double whammy. We do have to cover menopause. We covered hypothyroid and thyroidism. 3 Midas says, hi, it's 4 a.m. in Australia and I can't sleep. Good to find you chatting about mindfulness. Stay safe. Absolutely. You too. Zopiclone sounds like Soapy Zombie. If only. What's this? Ardin says, I've started to learn a new language working on Spanish. Awesome. Kamitha Z, greetings from Oklahoma City, Doc. We all got our flu shots this week. Awesome. Gracie Webster's loving the videos. Maz B, Dr. K from Lymington Spa, Warwickshire. Great mindfulness advice you gave. I live alone and work from home. It's all a bit of a challenge. Hang in there, Mazab. Linda Koss from United States says, quarantine since February the 6th. Oof. The wildfires we're having over here in Oregon, says Janny, just got hit by rain, so life getting better. Awesome. Gail from Alabama sending her love. Let's have a look. Susan Burt, I've lived alone for a little over a year since my aunt passed away. I hate it. I have never been myself. I hate eating by myself once a week, and I get together with friends for dinner. Well, look, Susanna Burt, you're here with us. There's 100 people online. We're all going to be sitting in our living room thinking about you, and I'm going to have a drink for you, Susanna. That's for Susanna Burt. I hope everyone found that little whistle tour of 6 useful tips on mental health and lockdown useful. We're going to cut to the premiere right now. So remember, today is Sunday, so I'll see you again on Wednesday. You might see the socks on Instagram, some little sneaky socks coming in there. So in the next clip, we've got this awesome video. Really going to love it. There's loads of hair in there. Let's cut to the premiere, and I'll see you all there. Take care, everybody. Ciao. Bye-bye.